Hi guys, Pete here from the Joint Physiotherapy and Allied Health. As an occupational health physiotherapist, I've been working quite a lot with my clients over the last few weeks to get their employees' workstations safe and ergonomically friendly for work at home. On the other side, I've also been seeing a number of patients coming in requiring treatment as a result of posture-related pain due to their workstation at home not being ergonomically friendly and causing them neck pain, headaches, lower back pain, leg pain, body pain. So here's a bit of information about setting up your workstation at home to ensure that you can best avoid any of these posture-related pain. Three big things to address when setting up your workstation from home: the chair, your desk, and your monitors. So firstly, with the chair, if you're fortunate enough to have an office chair, making sure that you're using all of the functions. However, based on my conversations with a number of patients over the last couple of weeks, a lot of you are working from the dining room table, the kitchen bench, or the couch. So if you don't have an office chair, here are some ways to make your dining room chair as ergonomically friendly as possible. So with your chair, it's the height and the seat depth which are most important, as well as making sure you're using the backrest. So first things, make sure you've got some kind of cushion if it doesn't have a cushion. When you're sitting on the chair, you may need to prop the seat with some cushions so that your hips sit above your knees. However, you need to be sitting with your hips at the back of the seat pan, and ideally adding some lumbar support. Two options with the lumbar support: if you've got some lumbar D-rolls which are prefabricated with a band which go over the chair. You sit with your hips at the back, and that provides your lumbar support. These can also be used for the car with driving long distances, and these are available at the clinic. Alternatively, a quick fix is a rolled up towel, however it won't be fixed to the chair. Place the towel where it feels comfortable. There's no right or wrong answer, it's just wherever it feels comfortable to go, and allows you to use the backrest and you don't feel like you have to sit forward. That's if you're using a dining room chair. If you are lucky enough to have an office chair, it's important that you're utilising all the office chair functions, especially the height of the chair and the back support. So, with the height of the chair, again, feet flat, hips above your knees. With the depth, you want your hips to be at the back of the chair. That said, what you don't want is to be all the way at the back of the chair, whereby the betters behind your knees may become occluded from the seat pan. Shuffle forward so that there's about a fist width between the back of your knee and the seat pan, and bring the back of the chair to you. Now you're here, use the backrest. So that's about setting up your chair, making sure you're getting the height correct and the depth correct, so you can use your back support to your advantage. Once you're set up in the chair, your desk is the next thing. Your desk height may dictate how you need to manipulate your chair. With your desk height, you want a desk that sits with some depth. Ideally, you need to be able to support your elbows on the desk, not so as much that you're resting the inside part of your elbow, which is where your funny bone and ulnar nerves sit, however on the fleshy part of your forearm. Slide all the way in your desk using the back support, and position your keyboard accordingly so that my arms are supported, my elbows sit above my wrists so I'm not up like so, and I'm not at a height where I'm too low. Alright, so that's the desk height. Sit all the way underneath the desk, feet flat, forearms, and sitting on your rest. Finally, your screens. This is critical in terms of neck pain and headache symptoms. So with your screens, best case scenario is you've got a full screen monitor which you're able to get from work. wireless keyboard, obviously a mouse. Mouse pad always helps. The screen should not be too close, a solid arm's length away, and making sure that the screen height is in line with your eye level. Seeing a lot of patients coming in working with laptops at the moment, finding themselves in a position where they are looking down, small keyboard and a little mouse pad, all hunched over. Ideally, set it up away from you to bring you from here up into here. Alrighty. If you're using two monitors, it's also important to make sure the location of the monitors is friendly for your neck. As you can see, if you've got a main monitor here and then you're going between the two, we're going to end up with right-sided neck pain and headaches. So make sure both screens sit at eye level with the gap in your nose. Keyboard in front of you so as your forearms are supported, and making sure that your feet are flat and you've got a fist width between the back of your knees for your chair. They're the three things to get right with your ergonomic setup at home. You get these things right and you're on your way to preventing a lot of posture-related neck pain, headaches, back pain. Any questions, 319-144-55, or you can book online for an online workstation assessment by myself. Thanks.